Dr. Albena Halpert interviews 2 patients with IBS about their symptom history, their interactions with physicians, and the impact of the illness on their lives. In particular, we learn about what factors enhance the patient-physician relationship. Several key recommendations are also made as a way to move on in their lives while adapting to the illness.
Perhaps we can start with you introducing yourselves and telling us a little bit about how the illness started for you, why you're here, or anything else you think we should know.
Hi, I'm Erin. Basically, I was one of those really difficult patients, coming from the genetic kind of point of view, where a lot of my family has anxiety, depression, bipolar, OCD, whatever, and then childhood trauma, abuse, that kind of thing. My parents got divorced when I was 14, and my dad committed suicide when I was 16. So you can imagine the years in between those weren't probably so good either. And so a year to the day that he committed suicide, which is July 4th weekend, I got my first IBS symptom. And I didn't see the connection. I don't understand. So I went to a lot of primary care offices and then GI doctors and over again. And I went to college, and so I became a dietitian, mostly because I had so many food issues. And the doctors couldn't handle any food issues. And there really weren't any dietitians that could handle the food issues with IBS either. And so that's basically my story.
So how bad did it get?
Extremely bad. So in the triangle of severe, or whatever, I was at the top of the list. Basically, college is supposed to be a time of socialization and everything. I couldn't grab a snack in between study breaks. I couldn't eat, first of all. There's only 6 foods I could eat for about 2.5 years. Everybody wants to know the 6 foods. Basically, pasta, tomato sauce, soy cheese, peanut butter, bread, and I don't know, I'm missing something.
Rice?
Rice, yeah, pasta, something along there. And I got scurvy. Can't imagine why. And initially I went to, go see a doctor. Okay. I went to the clinic at my college, and they said, oh, you have a rash. Put hydrocortisone cream on it. I was like, okay, well, it doesn't itch, but thanks. So I went to actually one of my nutrition professors, and she kind of knew that I had problems, didn't know the whole story. I wasn't as outspoken as I am now. I'll tell my story to basically anybody who will listen. But she basically knew I had some food issues. And she looked at it and she said, it looks like scurvy. I'm like, oh, I didn't think I was a pirate, but okay. So I drank just a whole bunch of orange juice. My IBS didn't like it, but the scurvy went away. Basically, the GI doctors that I saw while I was in high school, so I was 17 when it started. The first GI doctor was nice. I don't really remember him. He just didn't know what to do. He was just going through every system from top to bottom, and he made it to the stomach before I left. Second GI doctor was just like the interview, right behind the desk, big desk, lots of papers and computers, and lots of questions, and all the same information that was already in the chart, just asked it again, and did make sure I didn't have celiac disease or whatever, but not helpful. I said, well, I can't eat. What am I supposed to do? And at that point, it wasn't as bad as it came to be. But he said, oh, just take the high thiamine. You can eat anything you want. Very helpful. No, I couldn't. So I went off to college. Midway through, I switched from pharmacy to nutrition. So in between that summer break, I went to my third gastroenterologist, and it was getting worse. The hyoscyamine wasn't working anymore. That's the only drug they ever gave me, and never was given anything else. And, you know, big desk, interviewed again, all the questions, same with the chart, you know, lots of tests in between. So I said, I can't eat. What am I supposed to do? And she said, well, you know, you shouldn't eat things like broccoli, and then left the room. I was like, yeah, great information. And she's actually the doctor who said, oh, you need a colonoscopy. Like, okay. Did the colonoscopy, was in horrible pain. Never do a colonoscopy to somebody with hypersensitive gut, because very painful after I left. I don't know what I took, Klonopin, I don't know, a whole bunch of drugs. And never had a follow-up. Never gave me a phone call for results. Never, you know, called to check up to make sure I made it through that episode. And I never got my results until I graduated from college with my bachelor's in nutrition. And my mom, nobody was going to help, so she was going to fix it. She researched the internet, just scoured the internet, and found Dr. Drossman. And she said, we're going to North Carolina. Okay, so that's, you know, a 7.5-hour drive from where we lived in Pennsylvania. I came in and you know, Lynn Eckhart, who was there at the time, was writing furiously. And she said, where does your story start? Being able to tell my whole story, not in little snippets of this happened and then a test happened and this happened. And the whole story of starting out with childhood issues and then suicide and then all these problems with school and not having any really social interactions while I was in college, and then walking away from that. It's a 7.5-hour drive. So in that 7.5-hour drive, I thought to myself, you know, maybe this is connected to some psychological issues. And the second time I came back, he started me on Seroquel, and then he said, well, do you want to see, you know, or I think you should see our psychologist, Dr. Wineland at the time. And I would say, yes, I did want to, because having that positive experience with a doctor, I've never had a positive experience with a doctor until that point. Either the psychologist that I had gone with my mother to see, or you know, any of the primary or GI doctors that I had seen, was just like, you know, I have to gather your information, but I don't really care about you, and get out of my office because I can't really do anything.
So Dr. Drossman didn't have to tell you this is related to psychological issues. You came up with that yourself.
Right.
And the whole way back home, you're processing all this.
Right.
And things became clear.
Right. It goes beyond that 1.5 or 2-hour interview of, you know, you're only with a doctor for a little bit of time, but the rest of your life, your brain's always working over and over, and mine goes in circles. So, you have a lot of time to process. Like, yeah, he did say that, and I do agree with this, and talking it over with my mom also, you know, helped, because she wanted me to see a psychologist. She wanted me to get more help. But it was more of that interview that kind of opened my mind to saying, well, maybe there are some doctors that can help me. Because it didn't seem up to that point that there were.
So if you can give advice to the physicians you saw, I mean, not everybody has the expertise of Dr. Drossman. You saw primary care doctors and other doctors. What would be the 3 top things they can do to make the interaction better for you?
So primary care, slow down, okay? Sit down, first of all. Don't have your hand on the door. And just sit down, slow down, give the patient 15 seconds of that silence to process and answer. Because it isn't a script. It isn't like, oh yeah, I went to here and I felt, no, you have to think about it for a second. And it really doesn't take that long. I saw my primary care doctor, who I work with now, because I work in a primary care office. One, because it's a little bit of a story. I just wanted a lab slip so I could get my blood drawn. And he's like, no, I have to see you. Okay. So he had his own agenda as to what he wanted to get through. It was totally different than mine. And so for primary care, slow down and listen. Actively listen. Listen, ask questions, and actually respond to the answer, not just go on to the next question.
Okay. That's one.
So that's one. For GI, more is get to know your patient before you go into the exam room, because that is awkward. I'm just going to say that. And it's important not just to get the symptoms, but talk about the whole story about how you got here, because somebody doesn't just show up at the doctor, you know. I've had pain for 5 years, and here I am. They have a whole story that goes along with it, so that's extremely important too.
So active listening, try and get the whole story. Try to hear the psychosocial issues, even if there's not time to address them, at least acknowledge them. That's what I'm hearing. This is wonderful. We're going to have more questions, but maybe we can go to Wendy and ask her about how it's been for her. If you can tell us your story.
I guess maybe slightly similar in some ways, although certainly not as interesting a life. So, I was one of those kids that had a kind of upset easily stomach. Like, there wasn't a Sam's Club when I was growing up, but if there had been, we would have been buying Pepto then. So I'd always sort of dealt with stomach issues, but I just assumed that it was just part of my life. I did not really have a family that catered to illness. It was really get up and keep going as long as you can move. And that sort of became my philosophy for treating anything that I had to deal with. I would say I started having severe IBS symptoms in college, but that's because, well, at the time, I was sort of the black sheep of my family in that I was the first one to graduate high school, first one to go to college, first one to marry someone before giving birth to their child, you know, just doing crazy things like that. But I was just always really driven. So I was working full-time and going to college full-time, and I started having these episodes of abdominal pain. And I would let it go and let it go, and I would have diarrhea, but for me, it never started as diarrhea. It would start with abdominal pain and having no choice but to go to the bathroom. It didn't start as diarrhea. It would frequently start as a solid bowel movement until it just got to the point where there was nothing left in my body. But this would shut me down for 5 or 6 hours at a time. And that would happen whether I was at home or whether I was out. I've been trapped in more stores than I can begin to tell you. And it just gets to the point where you sort of live with this cloud of fear of never knowing when it's going to strike. So I had been from primary care physicians to gastroenterologist, and had actually seen a psychologist for a number of years who thought that there was a component to that, but never really thought that there was something, that it was any sort of a medication relationship that could help the two things. What my primary thing was that I just did not have time to have this condition. And I had moved on in my life. I lived in New York City. There were a lot of great specialists there. But I would go, and I always felt like their first question to me would be with, so you have diarrhea? And I'd say, yes, but, and I never felt heard after that. Because, you know, past a point, you can deal with diarrhea. You can take, and I've taken, boxes of Imodium to deal with diarrhea. What I couldn't deal with was this overwhelming pain. And it was just a really difficult thing for me to try and get them to understand that I could deal with the symptoms, but what I really, really needed was I needed this to stop, because I didn't have the sort of life where I could just not go to work. It gets to a point where it becomes all that you think about all the time, so that you I frequently had to travel with work, and so I would always have a carry-on bag that had an extra set of clothes, just because, New York City is not like North Carolina where you can run into any fast food restaurant. You can conceivably be called out and not have a place to be able to go to the bathroom. So I saw a pretty famous specialist in New York City who said to me, "Have you considered meditation?" And I was like, "Whoo, look at the time, gotta go." And I left. And so I really, I came to Dr. Drossman. I had seen another gastroenterologist in North Carolina who was a very, very nice man. But he said, I don't know how to help you. I don't know how to give you what it is that you need, but I know someone who does. And so when I came to that first appointment, I have to admit, I was skeptical. I really didn't think that there was a lot that could be done. I thought it was just my lot in life. And it was extraordinary.
Questions?
I heard with Aaron, it was connecting the mind-body thing that made a big difference. What was facilitated in you? Because I don't want to take credit for the change. You have to take credit for that change. What changed with you that you saw that put you in this place now?
One, that when I came to you, immediately the eye contact and the body language was completely different. It truthfully felt more like a therapy session than a doctor's appointment. Having you say to me, "I can't fix this for you, but I can help you with this." And I believe your exact words were, "Even if I can make it 50% better, are you interested in trying?" And having someone say to me, "Okay, I acknowledge that this is real and that maybe I can help you change the outcome a little bit to empower you to do that," was huge for me. It gave me the responsibility of saying, yes, I'm willing to try these different medications. Yes, I'm willing to investigate more. No one had ever even discussed with me the functional dyspepsia. Just like you said, it gets to a point where you don't want to eat anything because everything makes you feel sick. And just having someone say, yes, this is real, and yes, other people have experienced it, was huge. I did go on a Seroquel and Disipramine cocktail. I did have my Bentyl and my Hyamax for backup when I did still have an attack. But it just gradually lessened from happening 3 to 4 times a week to happening once every few months, and just being able to see that there was the potential for living a life where this wasn't the primary factor in my life. Before I even had this first appointment, there's a really intensive history that I had to complete. I had contact with Chris, and I continue to have contact with Chris, because even though I would see Dr. Drossman initially quarterly, I always had the ability to email her and say, or call her and say, this is working, but this is not, or should I up this just a little bit? So I always felt like that there was contact that I could make, and I always felt, and I'm sure you felt this too, that walking in the door, that Dr. Drossman knew who I was and what my story was. Now, that being said, he may just be an incredibly good actor and have power read that before he walked in the door. But I never felt that as a patient. I felt like he knew what my story was.
What made you think that he knew? Is it the comments he made, or?
The eye contact, the body language. "Hey, Wendy, what's going on? How are you feeling?" Just really a much more personal relationship than with any other doctor I'd ever had.
Time. This came up a couple of times. Dr. Drossman spent a lot of time the first visit. Not everybody could do that. Do you feel that that was a major factor, or do you feel like there's more what was done during that time? In other words, if Dr. Drossman, like physician type, can be having only 15 minutes or half an hour with you, how would you feel? Do you think it would have been less helpful? The time factor. Do you think the time factor is very important?
I think a certain amount of time is important, because if you do 15 minutes or 30 minutes, over and over and over again, you're reviewing the same information and not going anywhere. So I think, at least a certain amount of time, and I don't know what that time would be, is to get the whole thing down. And then after that, so the first visit, is long. But after that, all the story is told already. You have it all down, and you don't have to go back over it because we've already said it. And so then every time you come back, you can just move on. How is this working? What's going on? And it's much shorter periods because you don't have to repeat everything again. It's all down already.
I'm not sure that initial bond could have been created in 15 minutes. Dr. Drossman is incredibly charismatic and you feel an instant connection. I'm not sure if 15 minutes would be enough, but I think that you could make an effort to make it a more personal thing, especially when you get to someone along our level. There's a fairly extensive history that comes with that person. I had 3 colonoscopies in 5 years. There's a lot of information that's there to begin with. Yeah. So maybe even if you don't have the time to spend with that person initially, maybe just a little bit of homework initially, and then coming into the situation better informed.
Thank you. Given the time, I would like to thank you very much for coming here. This is extremely helpful. We appreciate it very, very much.